and the Democratic presidential race is narrowing to two very different candidates. Far-left Bernie Sanders and the more moderate Joe Biden. Biden and Sanders have clashed on the best approach to reforming U.S. healthcare. Sanders wants to get rid of private insurance altogether, while Biden proposes building on the framework left over from Barack Obama's Affordable Care Act.
Bernie says that you have to bring people together, and we have to have Medicare for all. But Bernie says, and he says he wrote the damn thing, but he's unwilling to tell us what the damn thing's going to cost. The idea middle-class taxes aren't going to go up is just crazy.
What Medicare for All will do is save the average American substantial sums of money.
Okay, so this is a huge bugbear for me. Right? It's a huge bugbear for me. Americans don't understand what national health systems are, right? They say it's socialist medicine, socialism. It's not socialism. It's social medicine. So, in America, you have like communities where everybody's got their wee house and their wee bit of grass in the front, and you've got like home ownership community people who come round and they tell you you've got to keep your grass cut, you can only put your bins out at this time of day or this these days. So they are basically telling you what to do. So in microcosm, if you're living in a community where you bought a house, you go there and you think you can do what the hell you want with your house, freedom, American freedom, and then you get this letter from the Housing Association or whatever it is. Yeah, you've got a name for it in America. I don't even want to look it up, right? But you've got somebody coming around telling you, well, you've got to keep your grass cut. You can't have this out on your yard. It makes the place look bad. You can only put your rubbish bins out on certain days. At certain times, blah blah blah, right? So you're being told, about what you can do in a house that you've bought. You maybe paid, £500,000, £300,000 for that, and you've got to do what this small little, Hitler community of people tell you what to do, And if you don't, they can fine you. They can just say, like, well, you didn't do this, and we're fining you $180, So is that socialism? Is that capitalism? I don't know what the fuck that is, but it certainly isn't freedom. Anyway, so when it comes to medicine, private healthcare, we have private healthcare in the UK. You're entitled to opt out of private healthcare, in the UK, so you don't have to use the NHS, and you will get a dispensation. You will get a small cut in the tax that you pay that goes towards national health. But the thing is, that tax that you're paying towards your national health doesn't just cover national health. It also covers a state pension, which every person when they turn 65 gets a state pension. It's somewhere around about £190, £200 a week or something like that, right? And maybe not as much as that, it's 120 or something pound a week, right? Let's just say £120 a week. So £120 a week, once you turn 65, you can retire and get a state pension of £120 a week, right? Fine. You paid it all your life. All your working life, you've been paying that, you know what I mean? So you're entitled to it, You might also been paying into a private pension fund and the work you were doing. So now you've got two pensions, right? So, yeah, you've got your state pension, which everybody's entitled to in the whole of Britain, and then you've got your private pension. And that's the way it works in healthcare. Even if you've got a private, health care package, private health insurance, Bupa or whatever it is, you can still utilise the national health. You can walk into any hospital. Oh, I forgot my paperwork for my private health care, but it's just a cut. I just want to get some stitches. they'll go and do it for you. You know, you'll wait a wee while because you're not, you know, it's not life threatening. Somebody came in from a car crash, they go in front of you, but you know, so you wait a wee while. But then you go in, you get stitches, no bill, and you fuck off out, right? Nobody's going to charge you anything for it. They're not going to look into whether you opted out. They just go, look, fine. You know what I mean? You're a British citizen. We're going to fucking stitch you up, right? So you've got that, and then you've got welfare, right? So say for instance you're working in a real nice job, and then the company goes bankrupt or something, right? So now you're unemployed. You've just bought a new house. You've got mortgage to pay, or you're renting a flat for somebody. You can go to the Social Security, the Welfare Department in Britain, and this is covered under the same tax as NHS and pensions. You can go there, you can register as unemployed, and they will give you something like £100 a week, right? It's not going to be a lot, but it's £100 a week. But you can say, I've also got rent to pay, that, you know, and they'll say, okay, well, we'll pay your rent. We'll pay your rent, we'll pay your electricity and stuff. You will pay your rent and maybe your water. I think you actually have to pay your water, but they'll pay your rent anyway. They'll pay your rent, but it's normally limited to like 16 weeks or something. And then they might say, well, oh, we can't give you the £120 we've been giving you. We're going to cut down to like 90. No. After 16 weeks, and then you get another 16 weeks of 90, and then they go, oh, we're cutting it down to like £77 for, you know, but that £77 will go on forever, right? If you never get a job, you've still got £77 a week after the Social Security, you know. And when you turn 65, you still get your £120 a week pension, right? Don't know what you're going to get with your private pension. If you know, it depends how long you've been paying that will be small, right? But you know, that's the way that the social network works in the UK, roughly. I'm not saying that I'm absolutely, you know, perfect with all these details, but that's basically how it works in the UK. We try not to let anybody fall so far below the poverty line that they end up on the street. Now, don't get me wrong, there is people who, through either alcoholism, just bad goddamn luck, or mental problems, find themselves on the street, and we try really hard to get those people off the street, get them into centres where we can try and help them, you know, into hospitals. We try to make sure they're on their medication, and we try hard in the UK. But yeah, people fall through the cracks. Every system has got flaws in it, but on the whole, the system in the UK is pretty good. But let's go through what we're going to see in this video, and then I'll come back to a lot of these topics and I'll talk about it, right?
The US already spends more money on healthcare than any other developed country. There's one country that spends less than half what the US does on healthcare, and people generally don't pay anything out of pocket when they go to the...
I'd like to say there are other systems other than the UK and the US. Canada's got a different system from the UK. Denmark, Sweden, Holland, France, Germany, Spain, Italy, they've all got different, national health systems, but they all do have a national health system. They also have private healthcare, just like the UK. You can opt out and go into private healthcare, But as I say, normally I think you're going to be paying, if you're not in a private area, you're going to be paying like 3.5% of your income. So if you make £1 million and you're paying your tax, 3.5% that goes to national health care, welfare and pension scheme, national pension scheme. If you're earning £180, a week, 3.5% of that is going to go towards, national health care, welfare, and your pension. That's just the way it is. You know what I mean? Everybody pays 3.5% of whatever they earn. So the more you earn, the more money they're taking out. But it's still only 3.5%. You understand what I'm saying? So I'm not sure if it's 3.5%, but I'm just saying that as a basis so we can just compare it to everybody. So if you're not earning a wage, well, you're not paying your 3.5%. That's covered by all the people who are paying into it. The problem, well, I'll get on to the problems later, right?
The doctor, the United Kingdom. And out of all the healthcare systems we've looked at, the UK appears the most socialist. The government effectively runs the whole...
No, I keep trying to tell people, fucking Americans and people, it looks like socialism. It's socialist. No, it's not socialist. It's called social. Social, as in community, as in we group together and help each other. I mean, that means that every fucking religious organisation in the world is socialist. Because what do? They do. Most religious places in the world, they take money off of you. You know, you give your 10%, and when your family goes into problems, you go to your church and you ask them to give you some money. They're giving you other people's money to see tide you through a problem, a difficult period until your husband gets a job, or you know what I mean? That's what our country does. We do exactly what your church does. Do you think your church is a socialist fucking entity? No. So why do you think Britain is a socialist country? We are not socialist. We do exactly what your church does for you. It's not socialism. It's social. It's community. It's gathering around and helping friends, neighbours. That's what Britain is, this one big gigantic church. That's what it does. It does exactly what your church does. So don't fucking get on my back about socialism. Otherwise, your church is a fucking socialist regime, with your pastor being your oligarch. You know what I mean? Come on.
Right now, the UK is having its own debate over how to reform the National Health Service. So how does the UK system compare to the US? And what reforms may be coming? In 2018, the United States spent around $10,500 US on healthcare for each of its residents. The United Kingdom spent around $4,000 US. That means the United Kingdom spends 9.8% of its GDP on healthcare, while the US spends 16.9%. Despite spending less, the United Kingdom manages to have healthier citizens who live longer and are less likely to die in childbirth. In 2017, life expectancy in the UK was 2.7 years higher than in the US, and the UK has roughly 1.5 times fewer deaths that could have been avoided by access to better healthcare. The infant mortality rate is lower in the United Kingdom, with 3.9 deaths per 1,000 live births, as opposed to 5.8 in the United States. And the maternal mortality rate in the US is nearly 1.5 times higher than in the United Kingdom. So how is the UK system structured so that it gets these results while spending significantly less than the United States system?
The National Health Service is a case where the British decided right after World War II that healthcare should be government's job, like paving the streets, putting out fires, running the library, running the parks.
That's T.R. Reid, author of the book The Healing of America. He traveled the world exploring different countries' healthcare systems.
It's a service you get when you need it, and you never get a bill. It's like going to the library. They don't charge you to check out a book.
Key thing about the NHS is it's a really...
Just want to talk about that guy, the American guy there. He's went around the world and he's looked at these systems, right? And he says, well, you go to the library, they don't charge you for taking out a book. But do you know how all those books got in that library? They took your tax money, bought those books, and put them in the library. And since it was your money that bought them, they said, we're going to give you those books for free. But there is stipulations. You can take a book out, you can have it for 2 weeks, and then it must be returned. And you can actually come in if you haven't finished it and just say, well, I haven't finished this book, can I take it back out? And they'll just say, yep, there's another 2 weeks to take the book home. They're not saying you can't have the book for more than 2 weeks. What they're saying is you can have it for as long as you want, so long as you keep coming in and getting it stamped and taking it home. You can have a book forever. You know what I mean? You just got to go to the library every 2 weeks and get it re-stamped for another 2 weeks. And you can do that every 2 weeks. Because your tax money paid for those books. This is what we do with our health service. Everybody pays their taxes. That medical facility, that hospital, those doctors are all paid with your tax money. You're entitled to go and use that service. That's how it runs. It's not socialism. It's social. We all pay in and we all have the ability to use it. And some people never go to a library in their whole life, but they pay the tax money to buy those books. Do you see people in America complaining that there's books in the library? And there shouldn't be? Well, yes, you do. I'm sorry, yeah. But only certain books. They don't complain about any of the other books that they don't like. They only complain about the ones they only complain about the books they don't want people to be able to read, right? So, and that's against the American Constitution. You know what I mean? The freedom of access. The freedom of speech, the freedom of to be who you are and, do these things. I mean, that's part of the problem in America. You dealing with these things, well, these things can be controlled by government, but these things can't be controlled by government. And it's like, why? Why can't the government control these things? You're paying your tax towards them. Why not? Well, in America, you don't pay tax towards your health system. Every other fucking country, industrial country in the world, does this in some means or form. But you call it socialism because, I don't know, you were brainwashed during the Cold War to hate the communists, and then anybody that didn't look like you was either communist or socialist, and that's just bullshit, you know what I mean? Anyway, that guy was talking there, about, different systems. He's looked at it, and it's basically a group of people put a lot of money into one pot. They're not all going to use it at the one time. Therefore, that money should sustain quite a large population over time, with only the people who really need to use it spending that money. And, therefore, there's a large pot there. Now, as I've said before, that reminds me of a church. That reminds me of a group of Christians living in a certain area, have a huge giant church. You all go there, you give your tithe. And whenever you fall in hard times, you go to your pastor and you say, we're falling in hard times, pastor, can you help me out until we get back on our feet? And if the pastor likes you, he gives you it, If the pastor doesn't like you, he may make voices about, we're having problems with cash flow at the moment. I don't know. But I imagine that happens in certain Christian communities where some people get and some people don't. Whereas with the system we have in Britain, everybody gets. They can't be refused. There's no pastor to ask. You go to the hospital, and at the point of need, that service is delivered, and then you go home without a bill because you're paying for it every week of your life. I don't see a problem with that. It's not socialism. It's not communism. It's community. It's social. Anyway, let's go to Dr. John Putis. I think that this guy is very, very important. You should listen to what he's talking about, because I'm going to belabor the point later when he's finished, right?
Risk sharing system. So everyone pays into it through their tax. If you need to use it, you don't have to pay anything else. So in a sense, it's not free because it's paid out of taxation.
Dr. John Puntis is a pediatrician who recently retired from the NHS. He is also co-chair of an organization called Keep Our NHS Public. All of his comments are reflective of the organization and not his personal views.
It's a fair system in that the more money you earn, the more tax you pay, and the more you contribute. But there has been discussion about whether tax should be increased to pay for sorting the NHS out in terms of the current deficiencies and problems, and that is controversial. I think a lot of people favour some tax increase, But then there are other people who say, well, maybe the focus should be on companies that don't pay tax and people that aren't paying tax as the first step.
I would call that socialized medicine. Government provides the care, government pays for the care, it's paid for through taxes.
I would argue with this guy right away. It's not socialised medicine, it's social medicine. As I said before, if you get a group of people ganging together to put money in a pot, and then over time some people need to use it and some people don't, but you all know that if my family needs to use it, I've got the ability to go and ask for it. That's not socialism. It's social. And that's why I think in Britain we have social medicine, and we have social democracy, and we have social capitalism. Because what is taxation? What is what you would say, if I tax a company or corporation for having the ability to freely sell their goods within the country, of Britain, we protect them from someone coming in and just robbing them, so yeah, they pay towards the welfare and the good of the whole country. I mean, they're not just paying for a police force to protect them. When they pay taxes, which goes towards the police, it protects the whole community. So it's not socialism, it's social, it's community. Different thing from socialist. Socialist and communist are completely different things from what you see in most of Europe. It's, I would say, social or community. You could just change it to community. Community health. It's a community. It's not a commune, but the next stage up from community is commune, and then that reflects on, going back to communism. No, we're not a commune, and we're not socialist. We are social and community. Isn't that everything you can say about any religious group in the fucking world? They're social and built around community. God.
Everybody's covered the same. To me, that sounds like socialized medicine.
The term socialized medicine has become a political football, especially in the United States.
If the NHS, if that's socialised medicine, it's great. And we hear this term mainly coming from the US, where it's used as for scaremongering. I would say
it is for scaremongering. For instance, if you've got a garden or a park in the middle of a city, you would maybe say it's a communal park. It's communal. Or communal. No, it's like anybody in the area can go and use it. Right. So is that socialism? Anybody can use it. Is it communism? Anybody can use it. Is it communal? As in, yes, we all help to, pay for the upkeep of it so we can all go and use it. Communal. Social. It's a social place where we can all go and socialise. It's not social. I can't. How many times am I going to fucking, bang this drum? It's not socialism. It's social. Anyway.
Say, if the NHS is socialised medicine, we like it, and most people are still very, very supportive of the concept of a national health service.
Each of the UK's 4 constituent countries have their own branch of the NHS, so rules differ slightly between them, but all of the branches operate under the purview of the UK Parliament. There are some services that require patients to pay something out of pocket, such as dental, eye care, and certain prescription drugs, but those fees are low compared to the US and vary by NHS branch. By one estimate from a data analytics firm, prescription drugs cost 57% less in the UK than they.
This is kind of like fake, right? Because it says that prescription drugs cost 57% less in the UK than in the US. But the thing is, although we bargain with the pharmaceutical companies to get the drugs 57% less than the US, I'm not just paying 57% less than what the US pays. I mean, if you go out and you pay $600 for a EpiPen or a whatever you call it, $300 for a MLIs or whatever you call it, right? In the UK, I wouldn't pay half the cost, right? I would go and get a prescription, and if I've got a month's prescription for like 15 different drugs, I can get a whole prescription of 15 different drugs for the whole month for £9. That's $12. That's not $12 for each individual item. I can have 15 drugs on there and still only pay $12 for all of them for the whole month. So my whole prescription is $12. I don't know if you go to a doctor in America and he goes, well, there's a prescription for an EpiPen and there's a prescription for what do you call it, asthma thing, and there's your painkillers, and then there's your there's another tablet for your blood pressure. And so are you paying fucking for each individual prescription? No, we just put it all in one prescription and you pay fucking $12 for that month's prescription. $12. And in fact, if you're a pensioner, if you're over 65, it's free. If you're unemployed, it's free. If you're pregnant, it's free. If you're under 16, it's free. So this is rather stupid for them to say prescription drugs cost 57% less in the UK than in the US. Yeah, what they mean by that is the NHS pays the pharmaceutical company 57% less. But then when they distribute it to the public, we pay a couple of pounds, £9 for each prescription. And that prescription could be every drug you need for the whole month. $12. Everything. So if you need 3 or 2 or 15 drugs a month, you know what I mean, you'll get all of it for $12 a month, right? This is why social medicine, communal medicine, is a fantastic fucking idea. And a lot of Americans, you think, well, that's raising my taxes. I'm going to pay 3.5% more tax in order to have, my social, medicine. Yes, but you know what? You can stop paying your fucking insurance company, your medical insurance company. Stop paying your copay. All that stuff goes away. So how much are you paying for your medical insurance? Well, take that, and just say, put that in your pocket, and then pay your $250 to $300 a month. I think you're going to fucking make out big on it. And this is what we're saying. If you go to the system we have, and you get your fucking government to argue with the fucking pharmaceuticals that an EpiPen shouldn't be £600 for 2, it should be like fucking $40. You know what I mean? And then they say, well, there's not that many people. We've got all the money. We can just charge people $15 a month for whatever medicine they need. And stop putting shit in your food. Start eating food like we do in Europe. Stop all this crap that you've got to fucking add to it. You know what I mean? You'll probably be fitter and healthier, and therefore not need so many medicines. You know what I mean? It's like, God, there's so much to talk about here, But anyway, okay, 57% less. That's what the UK government pays the pharmaceutical company. We pay £9 a fucking month for no matter how many drugs they're going to, because they put them all into one prescription. We pay £9 for that one prescription. We get all those month's drugs for £9, $12. America could be doing that as well. Fuck me.
Do in the US. Unlike with other universal healthcare systems that are only publicly funded, the government also runs the NHS. That means doctors that work in public NHS facilities are employees of the government.
Not only this, right, but this is the thing as well. The government pays to train those doctors and nurses. The government pays to train those doctors and nurses, and then once they become qualified, They go and work in like an NHS hospital to get experience and stuff like that. But then some of them sort of get tempted. They get tempted to go and work for like a private bupa or fucking Blue Shield or something. So Blue Shield is just what a doctor or a nurse who the government in Britain paid to train, and then they just, headhunted them. Come up for us, we'll give you like, $100 a month more than what you're going to get in NHS, you know what I mean? So they go and work for a private firm, Thing being, they can also still work for the NHS. So they can what you would call moonlighting, right? So they can work for the NHS and get their NHS pay, right? They work their 40 hours for the NHS. And let's face it, a lot of doctors and nurses in America are working 60, 70 hours a week. So, in Britain, you work 40 hours a week, you've got your national health pay, and then you go and work for a private company for 20 or 30 hours a week, and you get another fucking pay. That's what's happening. And then eventually what happens with specialists, doctors who spend maybe 8, 10, 12 years specialising in a subject in Britain, being trained and paid to be trained by the NHS, they then get to a stage where they're like a heart specialist or a lung specialist or an anaesthetist specialist. And then they just go, you know what, by NHS, all that money you paid to train me, I'm going to go and work for a private fucking company and fuck you. So now the NHS has spent millions training this person, and then they went and worked for a private company. And there's nothing that the government can do about it. They've not tied them into a 10 or 20 year contract. Well, we're going to pay to train you if you work for us for 10 or 20 years. They don't do that. They just train them and they expect them to work for them, and then they just bugger off and work for a private company. And then when the NHS needs somebody with that specialisation, they turn around and say, I'll come and work, you need somebody like me to work on this person who's really ill. Yeah, I'll come up, but I'm going to ask you twice the money that if I'd been working for the NHS I would work for. And so the NHS has been drained of money, it's been drained of the brains and the people we trained, and they're all going out there. And this happened because of Margaret fucking Thatcher going over to fucking America and talking with Ronald Reagan and coming back with this fucking idea that private sector is better. But if the private sector was better, wouldn't they be building their own hospitals and training their own doctors? Why does the private sector have to use NHS hospitals, NHS surgeries? Why do they need to rent NHS beds to put their private patients in? Why do they have to hire, because that's what they do. They're working as private, doctors. They hire the NHS surgeries, they have to book time in those surgeries also to do surgery. And then they come in and they use NHS facilities. Yes, they pay money to the hospital, but they pay NHS prices, but they charge private prices. So they make fucking bucks, right? And this is what I'm saying. We need to sort out our NHS. Private doctors should not be able to come in, rent NHS surgery, and put their patient above an NHS patient because they're paying money to the government. Oh, I want to hire that surgery, And then you get an NHS patient waiting an extra week because there's 2 or 3 private patients being used, using the NHS surgery. That shouldn't be a fucking thing. You shouldn't be able to book ahead of time surgeries and then some poor fucking cunt that comes into the NHS desperately needs that surgery to be done now, but he's fucking being held in a ward. You know what I mean? We're putting extra fucking drugs through him, we're keeping him library auction because we can't get him into the surgery because a private fucking doctor is using that for a private patient. This is what's fucking wrong with the fucking NHS. We allow that crossover between private and NHS patients using the same fucking facilities. We need to get rid of that. And a lot of people are going to say, how does that work? Well, that's how it fucking works. They can book ahead, they can book time and surgeries and stuff, and then that's their surgery. It's a thing in fucking the UK. And that was brought in by Thatcher after she went to America and seen how wonderful the fucking American health system was, and how run away and oh, it's going to expand your you know, and make your health system better and greater. No, it's not. It's actually extended waiting times because we have started to take on private health facilities and using our facilities. Our NHS buildings that we built with our taxpayers' fucking money are being used by private fucking companies to fucking service their private patients who they've drawn away from the NHS by saying, well, we can get you in quicker if you pay us twice the amount of money. We pay out half the amount of money to the fucking NHS, we can get you in. You know what I mean? And we make, double them. You know, we make the other fucking 50%. You know, that's what's fucking wrong, you know.
Most Britons receive their primary care through general practitioners, who are frequently referred to as GPs. They typically act as gatekeepers for secondary care.
This is another thing a lot of people don't understand. GP, general practitioner. He's a doctor. That's what he is. He's a fucking doctor. He went through 6 or 8 years of fucking training to become a doctor, and now he works as a GP, a general practitioner. That means he generally knows a lot of shit. So when you come in and you present with, symptoms and stuff, he's got such a wealth of knowledge, he knows, you know what, this is something that I can't deal with here. This is something I need to, make an appointment for you to see a specialist. He knows what it is wrong with you, but he doesn't know how to fix it. He can probably do something to help you, sustain you until you see the specialist, which might take a couple of weeks, you know what I mean? He knows that. If it's something really serious, and this is what a lot of people don't tell you about a GP, if you present with something in a GP's office that he looks at and thinks, this is serious, life-threatening, he can just go on the phone, call an ambulance and take you to the hospital and get you seen right away. Right away. Now, I don't know if you can do that in America. You probably can. But you know what? In the UK, when they call an ambulance and take you to the hospital and get you seen urgently because this is a life-threatening fucking thing, it doesn't cost you a fucking penny. Doesn't cost you a penny to see the doctor, doesn't cost you a penny to get in the ambulance, doesn't cost you a penny to go to the hospital and get operated on. Because some people do, they go into the GP and they think, oh, I've just got a pain, or, I'm fine, I've been taking some paracetamol and it's covered. And then the doctor finds out that, oh my God, this person's fucking, what do you call it? Anyway, there's the thing that explodes in you and kills you, right? Appendix. Your appendix could be, exploding in your stomach. He goes, oh, you've got to go to the hospital right away. And they'll take you to the hospital in an ambulance, they'll rush into fucking, surgery, and they'll take the appendix out and save your life, right? That will happen in the UK, and it didn't cost you a fucking penny, right? I bet in America, a lot of people don't even bother getting an ambulance or going to the doctor. They just sit in the house and I'll be fine. I'll take some fucking, paracetamol or codamine or paracetamol, whatever it is you take. I don't know, fucking painkillers. And then they wake up in the morning. Well, they don't wake in the morning. Somebody else wakes up and finds them dead on the couch or something in front of the TV. Rarely happens in the UK, because when people are in pain in the UK, they go, fuck this, you know what I mean? In fact, in the UK, you can just dial 111, talk to another, say, this is my symptoms and I feel fucking awful, and they go, you need to immediately go to the fucking, the ER, you know what I mean, the A&E. You need to just, call an ambulance or fucking get in your car or, get somebody to drive there or get a taxi. You need to go right away. Could you talk, these are professionals, 111 professionals, nurses, right? And if they can't tell you, but they think it's serious, they can say, can you wait a few minutes? And they'll call a doctor, and then the doctor will get on the line and talk to you and say, okay, this is it. And then they'll give you a proper fucking, what you would call like a proper doctor's sort of what do you call it, what they think, right? And they'll tell you either, oh yeah, no, that's fine, your temperatures aren't too bad, you're not too in pain, I take some paracetamol, I go to bed. Or they'll say to you, oh no, that is serious, you need to get to the hospital, get the AR now, you know what I mean? Accident, A&E, accident emergency. They tell you these things. In fact, this happened to my mum a few years ago. She had some pain, you know what I mean? And I was like, yeah, you don't look too good, Mum. And I phoned the 111, told them what they said, oh, you should get an ambulance right away. In fact, we'll send an ambulance. The ambulance was there. I think it took, an hour or something like that, because, you can't just get an ambulance. If it was somebody who had a heart attack and was unconscious, not responding, it would, they'd have been there in like 15, 20 minutes, you know what I mean? But it was about an hour or so. My mum was taken to hospital, got into the accident emergency. They rushed her straight into surgery and took her gallbladder. Her gallbladder was so bad, the doctor says, how the hell are you not feeling any pain for this? Because, she should have been in excruciating pain. The gallbladder was deteriorating and rotting inside her. Luckily, they said if she hadn't come in tonight, she'd have been dead. You know what I mean? That's how bad it was, and then luckily, when I was talking to Mum about it, I knew there was something serious. It wasn't just some pain and stuff like that. Because she had some pain, but it wasn't excruciating. The doctor said she should have been screaming, I said, no. But they got it out there and saved her life, and that's what I'm saying. This is why I love the NHS. And we all pay into it, right? We all pay, even if we don't use it. I mean, fuck me, I don't think I've never been in the hospital overnight, except maybe in London when I get buried under a collapsing wall and I had to be treated for dust inhalation. But that, it wasn't serious. I mean, we got out there. The guy next to me, he'd broken legs and that because some of the wall crushed his legs. But I was in a tiny wee spare, but I suffered from dust inhalation. But I was out within a day or two. But yeah, I mean, I've never had to go to the hospital for anything. I mean, that's an accident, these things happen. But yeah, I've 62, never needed to use any real emergency. I went in for cuts and bruises and stitches and stuff, but never needed to go in for anything major. No heart attacks, no blunt brain trauma or anything like that. No broken bones. Been very, very lucky. But it's there if I need it. It's there for everybody in the UK if they need it. And I just think, God, what America could be if you had a national health service like Britain. Can you imagine how many people wouldn't have died over the last 100 years if you had a national... Yeah, is it 100? 80 years, since 1945, 1950. Can you imagine how many people in America would be alive since 1950 if after the Second World War you had instituted a fucking national health service like every other goddamn country in the fucking built up world has done? God damn.
The problems that people are experiencing at the moment is it's taking longer to see your general practitioner if you want to see them.
Most GPs are private contractors with the NHS. They don't charge patients for care. Instead, they earn money directly from the National Health Service. Many GPs negotiate contracts with the NHS to determine how much they can charge the government for their services. GPs may
See, this is the thing, is that a GP, he's a general practitioner, he's a doctor, so he gets paid for each patient that he sees, and he's got a set level of payment for what he gets paid. So a general practitioner might see, 60 people a day, right, or whatever. I don't know. Like, so they start at 8 o'clock in the morning. Every patient gets, I think it's like a 15 or 20 minute, but if the doctor finds that he has to do something else, it can go over, and therefore people waiting. So I'm supposed to be there at 20 past 2, But the doctors had a couple of people where they had to spend a bit more time with, so yeah, it runs over. So there's 2:20, and then my name's not up on the screen, so I'm waiting, and 15 minutes wait, my name comes up. So I'm 15, or maybe in 20 minutes wait, and then I go in to see the doctor, right? So he gets paid for each patient and how much he's spent time on them. So there's bill, no, there's a price for everything that he does, right? But it's not like America where they charge you fucking, $10 for a fucking aspirin or something. You know what I mean? It's like, no, he's paid for his time and any tests that he's done, any blood he's drawn, he's paid for that, right? But they don't deliberately want to say to every patient, "Oh, go and draw blood." You come in, you talk to them, they say, "Yeah, okay, I reckon I know it is, going by you," because they've got a computer with all this shit on it. They say, "Oh, going by what you've been in with before, right? And it's this, so we'll just get a prescription, or, I don't think you need a prescription. I think maybe, you just got to, do this or do that. I think you'll be fine tomorrow. If not, gives an our call, or, call the NHS 111, you know what I mean, if anything untoward happens through the night. I mean, you know what I mean? We are practical in the UK. We don't have to send everybody for a fucking scan and a fucking x-ray and blood work every time they come in, you know what I mean? We've got their whole history there, and we say, "Yeah, you've been in here with us before, I reckon it's just that, bam, 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 get out of here and sort yourself out." Right, so a lot of people think that's not good enough. It's like, but what do you expect? When you get the same people coming in with the same complaints all the time, and there's nothing wrong with them, they're basically just people looking for fucking attention because it's free, you get a lot of that in the NHS. Time wasters. In America, people don't go to the doctor. They could be dying. You know what I mean? And they don't want to go to the doctor. You know what I mean? I would rather people go there wasting time and everybody gets basically the same treatment than people sit at home and die because they didn't go because they thought they couldn't afford to see the doctor. That's why I think that social medicine, not socialist medicine, social medicine, communal medicine, is the best fucking way to go. America needs to take it up. You need to sort your shit out.
Fund their own general practice facilities, or they can rent them from the NHS or private companies. One paper from the Journal of the Royal Society of Medicine found that GPs face many issues because of how general practices are funded in the UK.
Some GPs, I think increasingly, don't want to take on the running a business aspect of general practice. And so there are lots of GPs who are salaried partners, so they are paid by the practice to come in and work as a GP, but they don't do any of the business side of the stuff.
There's also a private sector in the UK's healthcare system. It's funded from a combination of
Yeah, I don't know if you understood what you were saying there. So I go to my local doctor's office, right? And there's about 6 or 8 GPs working there. But they have like a staff of, I think, 3 or 4 women who work the desk when you come in and sign in, right? So that's the administration. There's 3 or 4 of them, and they've got a whole room full of all their files and all that. But also the doctor's got it on his computer. And what happens is I go in there and I say, "Yeah, I'm here," and they go and they have a look, and they've got all my files in there, and they come in and say, "Oh yeah, you're okay." And they say, "Like, take a seat, the doctor will see you soon." So I sit there and there's a TV screen, you know what I mean, with adverts and TV and shit on it. And there's another screen that has got nothing on it but people's names, and their room number comes up. So I think there's 12 rooms. Some of them are not all doctors. As I say, there's 6 or 8 doctors, but some of them are nurses. So you might be there for, say, hand in or give a urine sample, or get blood drawn for blood work. And the nurse will do that. You don't need to see a doctor to go in and give blood, get a blood sample taken for them to send off to get, analysed. So there's several of the rooms are just nurses and stuff. And there's also rooms for consultation for like pregnant women and stuff like that, who go in and they see what an OB or whatever it is, you know what I mean? You know, someone who's not a midwife who's just going to talk to them about their pregnancy and how they're doing. They take measurements and weight, test their take their blood pressure and all that, and then tell them, oh, you're fine, go home, right? So there's rooms for that as well. So up it comes out, James Bunyan, room 8, you know. So I go down to room 8, I walk in, and there's my doctor. He's got his bed that I can lie in, he's got measurement things and weight stuff, he's got his desk and his computer, you know, it's all there, right? And he doesn't leave that, he's there for the whole fucking day. Every 20 minutes a new patient comes in, he sees them, he's got everything on his computer, and oh, I know, oh, I can see all your stuff here, oh, yeah, your blood work came back for, you know, last week, yeah, you're fine, you know, no. It's all that, right? So, it's just so much fucking easier to get shit done with that, rather than you going to a fucking, you know, I don't know, in America I hear so much crap about, you know, you go and you wait to see the doctor, and then you a nurse takes your blood pressure and all that, you know, your temperature, and then she says, like, wait here, and then the doctor comes like 10 minutes later. It's like, no. Whenever I don't see a nurse, I walk in and I see my doctor. And then I come out and the doctor tells me what, he gives me a prescription, or he doesn't give me a prescription, he tells me, oh, I'm putting you in to go to the hospital, you'll get a letter through within the next 7 days to go and, you know, get, you know, an x-ray or a fucking, you know, a scan or whatever. And it's like, it just works, you know what I mean? It just fucking works, man. But yeah, we're coming up to the problematic thing of why the NHS is starting not to work. I've already touched on it, where the NHS trains doctors and nurses, and then they go and work in the private sector, and then they come and hire out the NHS fucking surgeries and beds and all that. And then there's no room for fucking NHS patients, so they're on a waiting list. Yeah, we need to separate the private sector. They want to be private, build your own fucking hospital. Don't be using NHS. That's the problem. The private sector are using the NHS fucking facilities. They're using the scanners, they're using the surgeries, they're using the beds, and then NHS fucking patients have got to wait to get in there, because for some reason, private fucking doctors are able to get a bed before a fucking NHS patient can get it. That's fucked. And that came from America. That private getting fucking access and fucking putting NHS patients on the fucking back burner waiting for fucking weeks to get in, that came from America. And it's time that we fucking rolled that fucking shit back and told the private sector, you want to have surgeries, you want to fucking, you know, day fucking surgery, you want to put people in beds, build your own fucking hospital. But that costs hundreds of millions of pounds and they don't want to do that. The NHS has already built all these hospitals. Why don't we just fucking pay a fucking price to fucking rent it, you know what I mean? And that's where it fucking gets fucking shit.
Pocket payments, private health insurance, and the NHS itself.
The private sector is growing because it's being consciously promoted by government, and the boundaries being blurred.
Well, I think that private healthcare has been growing at a very rapid, steady pace in the United Kingdom for the course of several decades. That's going to continue.
That's not...
Yeah. Thatcher Centre for Freedom Heritage Foundation, right? Don't know what the fuck that means, but it's a very American fucking phrase, isn't it? Thatcher Centre for Freedom Heritage Foundation? What the fuck? This is not a British fucking thing. This came from America, and it came through Thatcher, as I've said before. And he says, yeah, that the private sector is growing. Yes, of course it is. Because Thatcher made it, you know, available for people to set up private fucking practices and use the NHS to treat their patients. They didn't have to build their own hospital. They could rent the fucking NHS hospital. They could rent beds and you know, surgeries and all that. You know what I mean? And how the fuck did that happen? Thatcher. Fucking Thatcher. This fucking prick.
Niall Gardner. He's the director of the Thatcher Centre for Freedom at the Heritage Foundation.
With regard to the National Health Service, I mean, there's no sign at this stage that the UK will be moving to a different system to the National Health Service. All British parties are committed to the National Health Service. I think that more and more Britons will be opting for private healthcare in the coming years and decades, not least because there are long waiting lists with regard to the National Health Service.
Not that because there's long waiting lists. There's long waiting lists because these cunts allowed private fucking healthcare, like Bupa and stuff like that, to come in and say to people, well, there's a long waiting list, and if you sign on yours and pay us twice the money, you know what I mean, that it costs for an operation, we'll get you in ahead of the NHS queue. You know what I mean? So they're going in ahead of the NHS. How do these fuckers get the right to fucking get ahead of the NHS queue and make that NHS queue longer? How is that fucking sensible? It's madness. It is fucking madness. If we didn't have this private sector, these people would be seen, and it would be the same fucking doctors who didn't fucking peel off and go and work for the private sector. They would be working in the NHS. They were trained by the NHS. We paid millions to train these doctors. Why are they not working for the NHS? I've got fucking no idea how people can fucking double think this shit. And this fat fucking arsehole, do you think he's a fucking doctor? Not a doctor. He's one of these cunts who works behind the lines, talks to politicians, says, well, if you change this little bit of fucking policy here and make it available for us to fucking rent that, and then, so we don't have to spend hundreds of millions building hospitals. No, we can make millions out of this, and we'll pay for you to get re-elected. We'll pay for all your posters and all that. This is what's going on. We are bringing the American political system into Britain. That's what's happening. And what America needs to do is bring the fucking British political system into fucking America. You don't need to be campaigning for fucking 2 years. You get fucking 6 weeks to tell people what you stand for and then let them vote. That's the British system. We don't get fucking, but we have an election, a major election, once every 5 years. And we don't get fucking, bombarded with fucking crap for 5 years. No. They wait until the last year, 1 year, and then you start to hear about politics and start to, interview politicians. The last 6 or 8 weeks is when you start to see all the posters go up and you get all the flyers come through your door. 6 fucking weeks, that's it. And then bang, vote. And then it's over for another 5 years. I think that's a pretty good fucking system. America, you get every fucking 2 years, every year. I mean, they stop one for, you just voted for some cunt, and then they're already telling you they want you to vote for them again the next week. It's like, what the fuck? You're never off the fucking voting cycle. You're never off of these bastards fucking poisoning your brain and telling you how horrible life is and people are coming to murder you and, oh God, how can you fucking survive with that and the shit wages you get? No fucking healthcare. What the fuck? You know what I mean? I'm amazed America hasn't just fucking down sticks and up sticks or whatever and moved to Britain and in Europe. At least you would get fucking healthcare, man. You get a fucking, a vaporizer, whatever you call it. You get that for like fucking $12. Are you fucking kidding me? Well, you pay for fucking $200, $300 for fucking, you get asthma. You know what I mean? EpiPen, $600 fucking dollars for 2 over here. Yeah, $12. You get 2 of them, no problem. What the fuck?
An analysis from the London School of Economics found that in the 2018 to 2019 fiscal year, NHS England spent around 18% of its total expenditure on the independent sector.
There's been a blurring of the boundaries, if you like. For example, cataract surgery, which is the most common operation done under the NHS. Increasingly, it's being provided in the independent sector.
This is what I'm saying. We've got an aging population. As you get older, you get cataracts. And what happened? Well, the fucking private sector went to all the fucking cataract specialist doctors in Britain and says, you know what? We're going to pay you, you know what I mean, like 30,000 a year more if you come and work for us. But you know what? They're using the NHS surgeries and the fucking all that stuff. They're using that to fucking carry out the operation. So, if you want a cataract operation, you can wait on the NHS for fucking a year, or you can pay for private and get it done in a month. You know what I mean? So, this is mental. But both my mum and dad got it done on the NHS. In fact, my mum got one eye done and then waited, I think she waited 3 months and get the other eye done because they didn't want to do two in case it went wrong and she was blind. But my dad, my stepdad rather, he went in and the doctor says, I'll give you the option, you can do one now and you can back in 3 months and get one, or I can do the both of them. And my dad says, well, do you think it's going to be successful? He says, I guarantee it's going to work. My dad got both of them done in the same fucking day. Bang, bang. And he could see again, you know what I mean? It's like, fuck me, innit? And that was at NHS. But this doctor who did that, he's a private doctor. He works for Bupa. But he has to do so much work for the NHS in order to qualify to work in the NHS hospital and be able to rent the NHS facilities, you know what I mean? So this is why the private sector also work for the NHS, because if they don't do so many NHS operations per year, they can't rent the fucking NHS surgeries for their private fucking, patients, So, yes, there is at least some kind of like, well, you've got to do it. You've got to work for the NHS. But they only do the minimum amount in order to be able to have access to the NHS facilities. Yeah, fucking bastard.
And the NHS has contracts with the independent sector to do that work. There are implications in terms of staffing. Private sector doesn't train its own staff, it takes it from the NHS, it cherry picks, takes the low risk patients, not the high risk patients. It has an impact on training NHS staff, and this is one of the problems with cataract surgery. If they're all going to the private sector hospitals, then the NHS staff don't become experienced in doing cataract surgery, and then along the line you find it's more difficult to staff your NHS unit. So it's not without negative consequences. We are paying private companies increasingly to do work for the NHS, including American companies, and they're very well established now, particularly in back office functions and providing advice on commissioning support, this kind of thing. They're very involved.
It says commissioning support and stuff like that. What he's talking about is more and more what Britain is doing is they're farming out the administration of hospitals to American private concerns who do the administration, and that's starting to cost us more and more. And then that's why the share of what we pay in the administration costs in the NHS used to be around about 3%. I think that was like 20 years ago. I think it's getting close to 5 or 6% now, so it's nearly doubled in 20 years. And that's because we are farming out our administration. Because Britain tried to do this huge fucking, let's change our whole computer system, and they hired a fucking stupid company. They spent billions of pounds on it, and then it didn't work. And they just scrapped it. They just threw those billions away, and they started farming out to, American and German. Some German companies are doing it as well, our administration. But this is what I'm saying. We could have done all that within the NHS if we had just increased. It's like America, $7.25 is your minimum wage, I think, in 2019 or 2020, 2021. Hasn't been up in a decade. We haven't increased the tax that we collect to put towards the NHS in like 2 or 3 decades. It's been the same, fixed. In fact, I'm not even sure they've increased it since fucking, the end of the Second World War. I'm not really sure. We need to just increase that by, you know, a couple of pence, you know what I mean? Fuck me. From 3.5% to fucking 4.5%, put it up 1%, you know, and then just put that money into the NHS. Why not? Why can't we fucking do that? Well, the politicians don't want to be seen to be raising tax, they say. Well, do you know what? I remember VAT being 7.5% in the 70s when I was a teenager. It's now 20%. 20% VAT. So they've raised VAT from 7.5 to 20%, but they can't raise the fucking, you know, national health payments to from 3.5 to 4.5 or 5%. They can't do that, but they've raised VAT from 7.5 to 20. I'm sorry, but I mean, VAT doesn't fucking help the NHS. In fact, if you could just do away with VAT and just raise the fucking national health tax to fucking 10%, well, you could fucking basically blow every country out of the fucking water. We could build new hospitals, we could buy all the new fucking medical scanner shit, we could have the best fucking medical health system in the world, we could pay our doctors and nurses and fucking cleaning staff top rate fucking wages. Everybody would want to work for the NHS if we would just do that. But no, they've never raised the fucking rate of what we pay for our national health, but they've put our VAT up to 20% from 7.5 since 1977. That's what I'm saying. When government does that, you know they're trying to kill it. They're trying to kill the NHS. They're trying to make everybody go public, private rather, because they know that, oh, my niece and nephew have just become a doctor, and well, they can't make enough money at the NHS. They've got to go private. So let's make the private sector, financially viable so they can become millionaires, like their mum and dad. That's what it's all about, man. Fucking know about the people. It's about the politicians' sons and daughters making lots of money because they were well educated and they deserve to get a good wage. They deserve to be millionaires. Look at the effort they put in, Fuck.
Unfortunately, that's likely to increase, and it's something which campaigners are extremely worried about.
I don't think anyone really believed that UK voters would decide to Brexit.
The news that the United Kingdom voted to leave the European Union shocked the world. The NHS was a big part of the Brexit media discourse, with the Leave campaign famously claiming that the UK would take back £350 million a week.
Here's another bullshit about this crap, right? Back in the 80s, the National Health Service was big. It wasn't robust, but it was big. It was doing okay. It was still under pressure, but it was doing okay. I lived in Britain at the time. I had national health coverage. But you know what? I wanted to go and travel around Europe. Now, there was a form that I could fill in Britain called an E101. And what that did is it gave me national health coverage in Europe. It gave me a certification that I could go anywhere in Europe, and if I needed to go to a hospital or get medical treatment, I could show them, that I've got a E101, and that meant that I got my medical coverage in Europe free. Any country in Europe, right? It was free. And then they would bill the NHS, and the NHS would reimburse them for any bills that I include for my health care in Europe. A simple form I could fill in. Now we have left Europe, could you imagine what it's going to be like if you're a British citizen and you're travelling through Europe and you have a heart attack or you break a leg and you're no longer going to get that money reimbursed by the NHS? You're going to have to pay it out of pocket because you're not a citizen of the EU anymore. And a lot of people who love going to Europe probably didn't realise that was going to be a consequence when they voted to leave the EU. How many people go to Spain every year? Millions. Millions of people go from Britain to Europe to Spain especially, the golden sands in the summer and all that, Benidorm and everything, yeah. If you fucking have an accident down there and you have to go to hospital, you're going to have to pay that out of pocket. We are no longer in the EU. The NHS is no longer going to cover you. You're fucked. You're going to have to pay fucking, travel insurance, health insurance to travel and that. How many people do that when they go on holiday? Most people don't even think of it. They're just excited about booking booking the holiday and deciding what place they're going to live in and all that and who's coming with them. They're not interested in, what happens if I fucking, break my leg, But this is what happens. Fucking Britain leaves the EU. You go and visit the EU now, you're not covered by the NHS. You're going to have to cover any medical costs. And who doesn't go there and get fucking, the trots or a broken leg or fucking something flies in your eye and you got to go and fucking get your eye seen to, you know what I mean? What the fuck? British people, man. Europe was a fantastic thing to be in. Yeah, it's fucking, ups and downs and all that, but fuck me. One of the biggest fucking trading blocks in the world, and Britain pulled out of it, and now we can't fucking trade with any cunt. Oh, fuck. Oh, well done, Boris. Boris Johnson, you're a fucking genius, you fucking asshole, you know what I mean? Well, where's him? It's Cameron that started it. But yeah, they're all Conservatives. Fucking Cameron, the bitch in between them, and fucking Boris, and now the bitch after them. All Conservatives, and they're all fucking the country over, man. Just a lot like your Trumps and your fucking, what do you call them? Can't remember. The cunt that just introduced a bill in America for fucking 15-week abortion limit across the whole country. You've never had that before, but and I don't know. Anyway, yeah, your politicians. This is it. Health care, it's got a lot to do with your politics. And when your politics is fucked, yeah, your health care is going to be fucked as well. And our politics have been fucked for, back in 20 years. Fuck me.
Week that could then be funneled into the NHS. The UK Statistics Authority has since said that the claim is a, quote, clear misuse of official statistics.
My name is Holly Jarman. I'm an assistant professor in the Department of Health Management and Policy at the University of Michigan. Those promises really did hit home for a lot of people. The idea that money would come back from Europe to the UK was a very powerful symbol. It's not actually true. That wasn't really how EU financing works. But we still saw that was a big part of the media discourse and most likely part of people's judgment when they were casting their vote.
The UK officially left the EU 3 years after the original Brexit vote, entering a transitory period through the end of 2020 while the UK government negotiates international trade deals. The concerns about private American corporations engaging more with the NHS came up during the discussion of the post-Brexit trade talks with the United States.
When you're dealing in trade, everything's on the table. So NHS or anything else, or a lot more than that.
Backlash to President Trump's comments on the
Yeah, that fucking backlash to them, didn't it? The British people said, it's fucking not on the fucking table. And the politician in Britain had to say, oh no, it's not on the table. And then he had to come back and say, oh no, it's not on the table. Yeah, fuck you, Trump.
NHS led to many British politicians assuring their constituents that the NHS was not going to be a part of the trade talks.
The NHS is in no way on the table.
President Trump then backtracked on his comments, saying he wouldn't consider the NHS as part of the trade deal.
Yeah, but they say this, but as soon as they get to the fucking negotiating table, which is behind closed doors, I fucking guarantee you the NHS is on the fucking table, you know what I mean?
Trade negotiations are actually quite secretive by nature. The two sides don't really want to reveal a lot about what they're looking for in a deal. Our concern really as health researchers is that the NHS really won't be accounted for in that deal. That the UK government's preferences have been shown to be largely economic and not so much on the focusing on the health of people in Britain.
Yeah, but this is the problem. They say the NHS won't be on the table, so they don't discuss the NHS. What they do discuss is private healthcare. And then they extend what private healthcare has got the ability to do, and they don't mention the NHS. But by extending the private healthcare's ability to do this and that and the other, it actually cuts off and cuts off and cuts off things from the NHS without them saying they're actually taking anything from the NHS. This is how politicians fucking get you. They lie their fucking ass off. They fucking lie their ass off. They don't need to talk about the NHS. They only need to talk about, well, how can we introduce, American style, insurance into Britain? And then they make a deal on that. And that in itself, by being introduced to Britain, fucks the NHS. But they didn't talk about the NHS. It wasn't on the table, you know what I mean? We were only talking about economics, you know what I mean? The economics of, how do we get fucking American fucking healthcare, like Blue Cross Blue Shield and all that shit, mayor into fucking Britain, you know what I mean? That's, you know what I mean? This is how they fucking get you. They don't talk about what you're angry about, they just talk about other things behind closed doors, and then the next thing you know, they pass these bills, and the next thing you know, what happened to my NHS? Well, you've still got it, it's just much smaller now, and there's more ability for you to become privatised. Because the private fucking system works. Look how well it works in America. You know what I mean? They spend 2 or 3 times as much for worse outcomes, and now we're bringing it here. And look how wonderful it's going to be for you to just die at home because you can't afford to fucking, get an ambulance, you know what I mean? That used to be free, but it's now, if you don't phone the right fucking number, you get a Blue Cross Blue Shield ambulance, it's going to cost you £1,000 fucking pound. That's how they get you. That's how they fucking get you.
The problem is that the NHS is already on the table. It has been for a while. The politicians who are now going to be negotiating the trade deals, it's going to be across many fronts. Campaigners were saying, okay, put your money where your mouth is. If you're saying the NHS won't be in a trade deal, then let's see legislation that sets that out so it's cast in stone. And they haven't rushed to do that.
Trade negotiations cover everything at once, and it's difficult to tell how they are going to be pushing for the liberalisation of drug regulations, and to what extent the Johnson cabinet would actually agree with any changes that would be proposed to the way the UK regulates pharmaceuticals. It's really a central government-led process that's not that democratic and does represent big business, and I think that's why a lot of people get very concerned and anxious around trade agreements.
There are some who say the NHS won't be harmed by Brexit, even in the event a trade deal with the EU isn't reached by the end of the year.
I don't expect that we're going to...
Well, I've just told you how the NHS is going to be affected by Brexit. If I go and visit Europe and I break my leg, I can no longer fill in an E101 here in Britain, so that when I go to Europe, I have a certificate to show to the hospital I'm covered by the NHS and you can bill them. That's not going to happen anymore. So the NHS is affected. My ability to use the NHS as a British citizen is affected because I can no longer use it in Europe. We are no longer in Europe. They will no longer be able to bill the NHS for any medical bills I have while I'm in Europe. That affects the NHS. And it affects me directly as a fucking British citizen.
To see huge changes actually in the Brexit era with regard to the National Health Service, and so I think with regard to the NHS, we're not likely to see a significant impact as a result of Brexit. I think the free trade deal will be largely focused upon the service industry, which of course is now the largest part of both the US and British economies.
Whatever effect the trade deals end up having on the UK, reforming the NHS will continue to be a big part of the country's political conversation.
People's support for the NHS in the UK is very strong. There's no other country that when we hosted the Olympics in London, we had nurses jumping on beds, and the NHS was actually a part of that ceremony and a part of that national celebration. The UK's NHS is very important in British politics. It's an important symbol of Britishness in that context.
And you'll see here as well, critical care.
Funding for this program is provided by contributions to your PBS station from viewers like you. Thank you.
Right.
Super Tuesday came and went, and the Democrat...
The UK's NHS...
Right, so what I was going to say here is why US hospitals are closing. I don't really want to go through this because I've already been through this. This is a long video, but I will say we've been closing UK hospitals as well. What we've been doing is centralising. So we've been closing a lot of smaller hospitals that serviced smaller communities, and we've been basically closing a small hospital here and a small hospital there and a small hospital there, and then building one big giant hospital here. And then everybody from all those outlying areas that used to have small hospitals, now everybody's got to come to this hospital. But there's only certain specialists in this hospital, and you've got another hospital like, another 50 miles away. They've got different specialists. So if you've got a heart attack, you go to this one. But if you've got sort of like liver or kidney, but you have to go to the other, that's where the liver and kidney specialists are. So instead of having hospitals that could basically deal with most of your patients, even dealing with things like cardio, liver and kidney, to at least stabilise you and then move you to a larger hospital, what they've done is they've shut all the small hospitals down and centralised things in big hospitals, which means longer journeys to get to these hospitals, which is putting patients' lives in danger. Because you don't get the chance to get stabilised in a small hospital and then moved when you're stable. Basically, they're rushing you miles and miles to a specialist centre, and by the time you get there, you might already be on the edge of not surviving. And this is the problem with centralisation, and it's a problem with the Americans shutting down hospitals. And although I don't know that the shutting down hospitals in America is the same as what they're doing in the UK, I think basically some hospitals are just not able to stay open because of the lack of people who pay for private healthcare. So when they come in, you bill them, but they can't pay. If people don't pay, your hospital shuts down because your hospital runs on, people being able to pay. Whereas if you had a national health system, these hospitals would get paid from the government. They would stay open. But if they depend on individual patients paying that can't, you don't want to say to somebody when they come in, oh, we can't treat you because you have no money. What America normally does is you treat them, you send them a bill, and you put that on your sheets that we're getting that money in, but the money doesn't come in, and then over time the hospital just runs down and it can't afford to stay open because people aren't paying their bill. Well, if you don't pay your people enough money to be able to pay their health insurance or pay their bills, you're eventually going to treat enough people where, we fucking spent this money and we're not getting paid. But like Trump fucking businesses, you know what I mean? Or the lawyer who works for Trump. I did all this work, I didn't get paid. Oh, I'm out of business. Tough fucking luck. Anyway, so on you fucking bad motherfuckers, I hope you can understand what I've been talking about. The NHS needs to be funded properly. We need to raise the tax to, fund it properly. Fuck the fucking private sector. There's always going to be a private sector. You've always been able to go private in Britain, even when they had the NHS. Rich people always had an individual doctor that could pay to see privately. It's just one of those things, you know what I mean? So, if you want to talk about get in touch, comment in the chat or whatever. I don't know. It's on your fucking bar.